Okay, so you'll see some symptoms in the rectum following some trauma or mechanical injury, and already mentioned that their breath or their flatulence. There could be really foul-smelling farts like rotten eggs. There could be rumbling in the rectum without stools, obstinate constipation after a blow to the epigastrium. So you may see constipation, straining or tenesmus. So tenesmus is a painful and persistent urge to go to stool or to diarrhea. Dysentery with dysuria in summer or autumn, diarrhea at night with cutting pains in intestines, and diarrhea of tuberculosis. Again, you're seeing the left side come up here, so it's worse lying on the left side. Prolapsed uterus, the muscles being relaxed after some kind of injury, worse for walking. So often with these pains, they are worse for walking. Strange, rare, and peculiar is that they're better for washing the whole body. They may have cramps. Again, standing and walking is not a good position for them. Anus feels as if it's bruised, and burning along the perineum during urination. So that is burning between the anus and that bit of skin between the anus and the genitals, or the scrotum, vagina. Okay, skin symptoms. Ecchymosis, that's just a medical term for bruising, but it's a particular type of bruise that is a black-blue bruise. So bruises from injury. Every little injury makes bruises. Bruises are black and blue. Eruptions from trauma. Red hot and edematous. So that's edematous is just an accumulation of fluid in the tissues, which will cause swelling, and the skin may appear hot, hard, and shiny, or dusky and mottled skin. Acne indurata is just a chronic acne, and it's characterized by symmetry and distribution. So you're going to see the same on one side of the face to the other. Very sore acne, itchy, burning eruption of small pimples. So you're seeing those crops. Remember crops of boils, but you're also seeing crops of pimples. So after scratching, the itching begins somewhere else, tingling and itching, which moves from place to place, and the crops of small boils could be anywhere on the skin. You might see carbuncles or bed sores or petechia, which is just pimples, groupings of pimples on the skin. Erysipelas is a bacterial infection. Scarlet fever when the eruption doesn't come out. Erythenostomium, which is basically an inflammatory condition of the skin. Corns, and also varicose ulcers. Okay, so you'll see some sleep symptoms as well with arnica. So unrefreshing sleep, but please compare that with lachesis, because lachesis will often wake unrefreshed after sleep. Involuntary stools during sleep. Sleepless and restlessness when overtired. Can't fall asleep. Fantastical illusions while lying awake. Frequent yawning in the evening without sleeplessness. Yawning before a chill. And they have that kind of comatose drowsiness about them, and awake with a hot head, and he may fall asleep while answering a question, which is one of the strange, rare, and peculiar symptoms. Dreams. So it could be nightmares with arnica, horrors at night. When dreaming, sees black forms or spectres, which is like ghosts or spirits. Dreams of death, dreams of being buried alive, suffocation, dreams of mutilated bodies, and anxious and terrible dreams. So we often ask about dreams. Sometimes the patient can't recall any dreams, but these kind of dreams are very indicative of arnica. So please consider that. Awakes in terror and then is sleepless. Awful dreams of robbers and murderers. Lots of stomach symptoms with arnica. but they need to be accompanied with other more keynote symptoms and often due to some kind of trauma or mechanical injury. So belching, tastes of, bad eggs after coughing, eructations of bitter mucus. They have a lot of gas. The stomach may be distended. There'd be pain in the stomach during eating, and maybe some spasms or griping pains. And they may feel pressure as if there's like a heavy weight in their stomach. Feeling as if the stomach was pressing against the spine. There may be a lump in their stomach, and they have more motion sickness, hiccups, nausea, retching at night, or some fetid vomiting. And if there is vomiting, you might see a little bit of blood in the vomit, in the vomit, or it could be coagulated. This will probably occur after an injury, and if they're vomiting food, you may see specks of blood in the food. Okay, so now we have dysentery stools with muscular pains, brown or white diarrhea. The stools will be offensive, bloody, and involuntary. Involuntary is a keynote of Arnica. Stools look like brown yeast. They must lie down after every stool. Stools may be bloody, foamy, pus-filled, and again, involuntary during sleep. Ribbon-like stools from enlarged prostrate or retroverted uterus. Now, retroverted is when it's like a abnormal anatomical tilt, and that could be caused from a trauma or an injury. Stools, again, you're seeing the blood or the mucus in the stool with the urging and tummy ache, and you might see undigested food in the stool. Teeth. Arnica is a fantastic remedy to give after any kind of surgery or dental work. So you're going to see swelling, pain, soreness. They have tingling in the gums, toothache, which will be throbbing in nature, or it could be cutting or a tearing pain. Now, when it comes to temperatures, so that's the heat within the body, they're often chilly, but their head is hot and the body is cold and chilly. You may see one cheek red or both cheeks red. There could be a coldness on the part they're lying on. There's a thirst during the chill. They must uncover, but they get chills from it. And you'll see that shivering over the whole body. Internal chills with the heat of a fever, heatness and redness of the head, but the body is cool. So that's coming up a lot. The red head, the hot head and the cool body, and heat flushes with thirst. So can be given as a flu remedy, and maybe, the influenza comes on after a shock or a trauma. That's when you think of Arnica. Intermittent fever, typhoid fever, and septic and traumatic fevers. Throat, there can be tonsillitis, and you're going to see swelling. You're going to see that redness, burning, stinging pains, a raw feeling. Could even hear a crackling in the trachea, which would be worse for lying down. And there's a hoarseness from overuse of the voice. Maybe I need an Arnica now. Okay, worse exertion, the hoarseness, or worse for getting cold or getting wet. Hoarseness waking up in the early morning. Voice deep or low muttering. Tongue. Again, all these symptoms need to be accompanied by keynote symptoms or causation symptoms from trauma or injury. Tongue would be dry, maybe it looks black. Biting, burning, and scraping at the root of the tongue. Red stripe down the center of the tongue, or the tongue could be coated white. And there's a dryness in the mouth and the tongue. So lots of vertigo symptoms with Arnica. Arnica is a very good remedy for vertigo. So chronic vertigo, where the room seems like it's spinning, and it definitely could be worse walking. Vertigo of the elderly. There could be nausea, vomiting, or diarrhea with the vertigo. Worse while walking, which you've seen a lot with Arnica. A lot of their symptoms are worse with walking or sitting erect. Worse with a head injury, worse with headache. Could even be worse with toothache. and worse on rising or moving. Vision can be disturbed, so you're seeing double diplopia. Diplopia is double vision from trauma, and there could be some little hemorrhage from the eye, maybe some paralysis, so you might see the eye hanging downwards. There may be vertigo, worse, looking downwards. High objects appear to lean forward and about to fall, so they're very off-center. Flickering, they could see flickering, and that's going to be made worse with reading or writing. They have a headache, loss of vision. They could have a disturbance in their vision when they're looking at words on a page and they're dancing around the page. Muscular volitantus, which is eye floaters, and obscured or loss of vision during headache. Okay, so this is constitutions. So we talk a lot about constitutions in homeopathy, and there's a few different interpretations about what constitutional prescribing is all about. So when I'm talking here about constitutions, I'm just talking about their general constitution. Are they the kind of person that is prone to muscular pain and fatigue? And that will become apparent in your case taking. And are they worse for physical exertion and trauma? I mean, most people are worse for trauma, but you will see in some patients that they are particularly more worse for traumas. They could be anxious types of people. They often are. Lots of irritability. They're very active and they're quite athletic. So they're the constitutional types where you might think about prescribing arnica. Okay, relationships with other remedies. So complementary. So you could give these remedies together, although I would be giving them with a good distance apart. So if I was prescribing, so complementary remedies are arnica, aconite, and ipecacuanha. So if I was giving arnica and aconite, I would probably give arnica say in the morning and aconite in the afternoon. But they complement each other very well, aconite and ipecacuanha and arnica, and they can be used and they follow well. So when thinking about arnica and whether to prescribe that remedy, you're also going to think about other remedies, so you need to compare. And some of the comparisons you'll make with arnica is aconite. So often we say about aconite's great remedy for the eyes. So arnica has eye symptoms, but aconite is to the eyes what arnica is to the muscles. And Baptista, you're going to see a lot of that heaviness and soreness in the body. Hamamelis, you're going to see with some blood, there's some similarity in some of the, it's also good for the blood. Rustox, you're going to see where their limbs have been affected and the movement, that rustox will be better for movement, whereas arnica won't be. And hypericum, that's injury to nerve damage. So that and arnica, they can be quite similar sometimes in some of their symptoms, and they actually work quite well together. Now, arnica is antidoted by camphor. So most remedies are antidoted by camphor. So if ever you give arnica and then you decide it's the wrong remedy, usually I wouldn't bother antidoting it unless in extreme cases where they maybe aggravated their symptoms, and then you could think about giving the homeopathic remedy camphor. And they're the references. So all the symptoms and the rubrics that you will see on this PowerPoint presentation are covered in these materia medica. So I've given you all the rubrics and all the symptoms for arnica. And some of them are lesser symptoms, so you might not see them. You really want to look out for the keynote symptoms. You really want to look out for the causations, which is, I've stated many times, is mechanical injury and trauma. So I've used William Boraker, his materia medica, which is great, and it's a great one to use. And I've used Clark as well, and also Murphy. So thank you for your attendance, and I hope you enjoyed this PowerPoint. See you again.